Pledge of allegiance. I pledge allegiance to the flag
of the United States of America and to the republic which stands indivisible, with liberty and justice for me.
Thank you all for that. Ms. Teresa, can we have a roll call?
Commissioner Matthew,
Here.
Commissioner Hoffmeister,
Here.
Commissioner Houts, Commissioner Leininger,
Here.
Commissioner Baker, Commissioner Lanius.
Present.
Thank you.
Thank you, ma'am. Moving on to item C, approval of the agenda.
Move to approve.
We have a motion.
Support.
Support. Any further discussion? Seeing none, all in favor with an eye.
Aye.
All opposed, the same. Motion carries. Letter D, approval of the minutes from the February 22nd meeting.
Move to approve the February 22nd, 2024 Board of Health meeting minutes. Support.
We have motion support. Any discussion? Seeing none, we'll all in favor with an eye.
Aye.
Opposed, the same. Motion carries. Were we going to do the meeting, the minutes that we just saw?
No, they come later.
Okay. All right. Very good. On to number 2, public comment. Very important time in our meeting. We have public comment. Anybody in the public like to address the board of health? All right. Well, don't feel obligated. We'll see how it goes. Probably get some at the end, maybe. All right. Moving on. We'll close public comment. On to Ms. Rebecca Burns, Health Officer's Report.
Good morning.
Good morning.
So, wanted to start by giving you an update on our progress at our Hillsdale building. The painters are in there and about ramping up, I think. Now they've been in there a couple of weeks. The staff are reporting that things look really great. They're very excited to, have a fresh, nice looking facility to welcome our clients. I do want to recognize Shelby Ward, James Young, and I forgot Terry Penny. We have 3 supervisors that actually work in that building, and they've really been helping to coordinate with the painting contractor. So appreciate them. And the carpet contractor, we have placed an order with them, and we are working with them on a schedule to get carpet going in that facility very soon. So as soon as painting's done, we'll be able to get started on carpet. The staffing update, environmental health is working to fill the sanitary position that was opened in Three Rivers by a staff member leaving the agency, and just starting to work on filling summer vector-borne technician positions. In personal health and disease prevention, I think we're still seeking a part-time nurse, and have made a conditional offer for a clinic supervisor role that lady vacated. So hoping that is moving along. You do have audit information today. The actual presentation of that won't be until next month. That is when the auditor is available. But we do have the information here for you today. I did want to let you know that our agreement with Manor Costerison goes through September 30th of 2024, so they are on contract for one more audit after this one. They finish up the year, but then they do the audit after the year closes. COA, kindergarten oral health assessments. We're continuing to work on reviewing program information from currently operating COA programs of the health departments and considering the resources we have in place to support the program. We're also exploring opportunities to increase collaboration with MCDC, working more closely with their CEO on current dental fluoride treatments that we provide in our WIC program. As part of Beacon Health System, that's the hospital system that operates in St. Joseph County. They are starting their community health needs assessment process. And I was invited to attend some of their initial conversations and trainings the last couple of days. That's where I was at in South Bend. I think it's going to be a very interesting opportunity. There were 27 different agencies that were part of the event that I went to the past couple of days. most of them come from Indiana, right? Because Beacon is primarily located out of that Indiana area. So I was able to network with a health officer in Elkhart and other individuals that work in the healthcare industry just across the border. So it was a good opportunity to not only learn more about good techniques to conduct a China, as we call them, but also to know. We do have MERS providing some staff education sessions on the retirement programs that we offer. And so they are welcome to attend those. And our health education and promotion team is hard at work on our annual staff training day, which is April 26th. Concerned about measles cases, and I know Heidi has some of this in her report today as well. But we've had 3 identified cases in Michigan and cases south of us in Ohio and Indiana. So, and with the low vaccination rate, it just is very concerning that we could have a case here that would cause spread. Health concerns in teens, as you probably are aware from reports in local media and updates. We are working with Quincy Community Schools to investigate complaints of students with neurological symptoms. A survey was made available to families with students in Quincy middle and high schools. And the agency is currently reviewing information gathered as a result of that survey. And the purpose of our work is to try to identify issues and act, if any are found, to correct or mitigate to prevent illness. This is really classic public health work. It's also very frustrating at times because we are hopeful to gather lots of information, but sometimes people don't want to share and they have the right not to. So we use the information that people willingly provide and do the best that we can to see if we can make any sense of what's going on. And we are yet to see if any sense will come from this one.
Sure.
The MELF Day at the Capitol, as I've mentioned previously, is scheduled for April 10th. I will be attending that. I think, are you coming too? Dr. Lucarell is coming and Chris is coming as well. So it'll be a good day in Lansing. And Elevator Company is coming April 17th through the 19th. That's when we're on the schedule over in Hillsdale to get that taken care of. And no new update from the hospital in Hillsdale regarding use of the mobile van today.
Very good. Thank you for that report. Any questions for them?
Yeah, I have a question. With regards to Quincy, can you bring the board up to date on the condition of the students that have been affected by this mysterious outbreak?
Well, so this is where we're at. We gathered information from those who voluntarily reported, and then if they reported a student with a particular symptom set, then we reached out to them asking for medical records that would help us to understand what treatments and conditions and diagnoses and stuff like that they may have. As far as, being able to tell you exactly, how those students are doing or if they're in the hospital or not, no, I wouldn't be able to tell you that because we don't necessarily know.
Okay.
But we are working to gather those medical records. I think we probably have gathered as many at this point as we can. And there is going to be an opportunity for everybody to sit around and review those and do what's called medical record extraction process to try and see if we can make sense of any commonalities. So.
One more question.
Yeah.
Can you expand on the measles? Does it in fact show that the outbreak is from migration?
So the cases that we know about in Michigan have all been as a result of international travel. Where the concern lies is that measles is highly contagious. So when someone is in their infectious stage and they leave virus along where they've been, it it can affect another person for quite a number. Do you know the time? There's a period of time that that virus is still infectious, laying on surfaces or in the air or whatever. And so that's the concern with more and more people that are not vaccinated and have no protection that way. And because most of us have not had, actual exposure to measles itself, if you didn't get vaccinated, then there's no protection. And because this is so highly contagious, and the virus is hardy, it just sets us up for an opportunity for an outbreak. You guys can probably say this better than I just. But
No, we're good.
Okay.
That's good. And you're, even 4 days before the rash breaks out, you're shedding virus. So that's, I think, why it's so frightening too. You wouldn't even know that the kid has measles that your kids are playing with or in daycare with or at school with because they don't even have a rash yet. So,
Yeah,
no,
It's
it's
right.
that safe
6
exposure period, yeah.
up to 6 days prior
Yeah.
to fever, right?
Mhm.
It's interesting that you confirmed international travel.
that is the information that's been shared with us by the state. We don't know anything more about it than that. So I can't tell you if these are refugees that came to our country, if they're families that went overseas and came back. I do not know.
So if you, I have children, they're getting older now, but through the normal vaccine packages that they got when they're younger, measles is obviously a part of that, correct?
Mhm.
Measles, mumps, and rubella.
There you go. All right,
12 to 15 months and 4 to 6 years.
is when they get that. Okay.
Probably 25 other vaccinations.
That's right.
Needle, right?
But that's a good question, because if you're not sure and you want to check, you can go and check yourself using the state resources online, or you can call your primary care. You can call us. We'll be happy
Fine.
to look up that information for you.
Very good.
And just because you had them when you were a child, there are certain conditions when you can get a reoccurrence. Is that right?
If you had measles as
Yeah.
a child, I don't know the answer to this.
I think you can
Can
get
you-
them under certain
Yeah, I would guess it would depend on how your exposure went, but
compromised immune system.
probably.
Thank you, Mr. Chairman. Health Officer, thank you for that information. I have a question in relation to our commissioner mentioned. Can you report any identifiable measles in our district?
Not at this time. That's what we're hoping to avoid.
Okay, that's good news. Secondly, are we working with any major industries where employees may not have measles administered before they came to this country or area?
We see a lot of folks that are brought in by some of our local employers that are needing vaccines. Heidi, I don't know, do you want to share?
We're currently working with that population right now, and it's kind of in the beginning stages, but we did schedule 10 families this past week, and we're able to vaccinate them. So that's just kind of in process, but there are a few that need a lot of those vaccinations. And it is part of their a requirement for them to come here. They have to have these done within 90 days. So
That point out something. So those citizens who are working or their spouses or families, they come here. We do not know they have already that rashes or initial period. So we are going to spread our employees here. Isn't that a good idea to go over there? We have a vehicle here. I mean, I'm just throwing this out. It concerns me.
to go to with the place where they're working,
Yes, in cooperation with those companies?
Yeah, that's a possibility too. We're looking at that too.
It's, you just, and as we already mentioned, you just don't know. And, you know, but people go everywhere. You know, they ride the transportation system, they ride, they're in Walmart, I mean, they're just, people are everywhere. So,
Right on.
And the other thing on that is there may be a segment of those individuals that are working at the employer. If they're here with other family members, those other family members are not working at the employer, so you know, you're only potentially only covering part of that exposure by going to the employer, where if the entire family comes here, you can take care of the entire family.
Good point. Any other questions for the health officer?
Yeah.
Yep, go ahead.
Back to the Quincy school, and that, you know,
Mhm.
you described that as a neurological issue, and having a daughter who has had some neurological issues and all of the tests that we've gone through and still discovered nothing.
Mhm.
Probability that this issue in Quincy will never know exactly what caused it.
that could very well happen. Yeah. Sometimes it's a little bit easier to identify like a salmonella outbreak for example, right? That comes from a common food source, then it might be to discover what exactly is happening to cause these neurological symptoms.
So one thing that frequently doesn't get tested for is heavy metal poisoning.
I
And I
think-
know I went through that with my wife,
Yeah,
and that can lead to that word.
Neurological.
yeah, it's
Yeah,
a
that
crazy
word.
word, yeah.
I turned to the dentist yesterday, so I looked up. But, that can lead to some of those conditions, and I know that from firsthand experience.
I think some of these youth have had that testing done as well.
Yes.
Yeah.
My last question for the health officer, we spoke at, we actually had a lady come in, her name's Amy from the Michigan Association of Counties, and talk to us about the opioid settlement.
Okay.
And in St. Joseph County, we've decided that we're going to put together kind of a task force to move forward with trying to spend that money in the best way possible, most effective way possible. And I know Teresa said something about reaching out to you and having you a part of that task force. Have you spoke to Teresa at all about
Not recently. She has mentioned that in the past to me though.
Okay.
So certainly welcome to sit up on that, or if there's a staff member that might be better suited, happy to do either way.
Okay, we'll be on the lookout for that because I think that's coming down the pipeline.
Right, okay, good.
Very good. Thank you again. On to Dr. Luparello.
Morning.
Good morning.
So my monthly report is in the chart. Not much new there. Thank goodness we had our hands full the month before. So, just kind of winding down treatments for our latent TB patients, and they're all compliant. It sounds like they're doing well. So, and I'm working on my diversity in healthcare class and still doing the supervisor class that we're all doing here. And then my report, this is very exciting, but the CDC released some new COVID guidelines, really a new respiratory virus guideline on March 1st. So that's kind of getting some press, and we're getting some phone calls from schools. What should they do? What are the new guidelines from places of work as well? So I thought I'd just review that. And while the COVID health emergency has ended, we all know that we still have COVID around and that it's still a threat, especially to certain populations. So CDC kind of grouped influenza and COVID and RSV as all obvious respiratory virus issues, and kind of gave this guidance. So you'll see again that they're advocating for vaccination and they're advocating for some isolation if you're sick. But things have changed a little bit, where we used to automatically say, okay, you're done, stay home for 5 days, and that progressively went 10 days, 5 days, etc. Now, they give guidelines if you have not had a fever for 24 hours and you're not on any fever reducing meds, if you haven't been vomiting or having diarrhea for the past 24 hours, then you can, with some precautions, and seeing your healthcare provider and getting your release, head back to school. So it's no longer because you had a positive COVID test, you must stay home for 5 days. If your symptoms are abating and you have no fever, you can actually return. So return to work and school. And they're advocating that you mask, but even that is not a direct, hey, you should mask or you must mask. It's we would like you to mask and we would like you to stay away from people. So my patients will always ask, and what I've been saying is that I feel like in our community, I mean, the world in general, we should be more conscientious of individuals and people who need us to protect them. So, if you come into my office and you have a mask on, I will always ask you prior if you want the rest of us to mask, because maybe you have a mask on because you have chemo or you're immunocompromised for some other reason. And it's only fair that we as a community and a health department and people advocating for health look out for those that are more at risk. So I really think if we just keep that in mind, so we don't send our kids to school or with diarrhea, and we keep them home until they're fever free, and we don't go back to work if we have a fever. And I think that it's important to just protect those individuals that are going to really get sick still from COVID or RSV or so. But again, don't forget that immunizations are still recommended, and you just need to protect other people and yourself if you know that you're immunocompromised in some way. Washing your hands, of course, clean air, and eating healthy foods and drinking lots of fluids. But otherwise, that has changed just a little bit. And the CDC actually has not officially put out any school recommendations. If you look on the CDC website, it's still from the summertime, from July. But we're kind of going with their guidance in general. So when schools call, we're kind of giving them this, and we wrote up a little something, and that's going out to all schools as well for good communication. And that's it. Yeah, and I am a little nervous about the measles, so we're watching. It's getting a little closer. Chris just said this morning that there were some cases, a few more cases in the Sandusky area. So I'm concerned. Our immunization rates are kind of low especially for a vaccine that's been around forever, right? We all had it. I mean, it's one of, if you want to argue about the COVID vaccine, okay, a little newer, I get it. I get the concern, but the MMR has been around and safe, and it would be great if we could kind of get a little progress with getting families vaccinated for that, especially.
Very good.
And I think that's all I had today.
Thank you. Did anybody have any questions for our medical director? All right. Well, thank you.
Thank you.
Moving on. Department reports. Environmental health, Paul.
Good morning.
Good morning.
Becky touched on a little bit, as far as our staffing goes, we still have an open position for sanitarian in St. Joseph County for person that moved on to another health agency. We haven't had a lot of response on that position, but we do have 2 interviews scheduled for next week, so I'm encouraged by that. We have one on Monday and we have one on Wednesday, and so glad that we're getting some people. We've had a couple other applicants that we were interested in and contacted, and they never called us back. But we do have 2 that are set for interviews, so we're looking forward to that. The 2 new sanitarians that started have been very busy working with Joe and James and training, and we're trying to cross train everybody, so we're not focusing on working on the general side, working on the food side. So as we're bringing in new sanitarians, we're trying to train them on all aspects of the health department, all the things that we do, so they have that versatility. That's not to say once they get up and going, they're not going to be more focused in an area, but at least they'll have the diversity to be able to fill in those other areas when they are needed. So we have just posted 4 positions to fill for our vector techs. We have at least 2 openings, and possibly a 3rd. We're waiting to hear back from one of the young men that worked for us last year We're heard back from him on the 1st of April. But this is gonna be kind of a big transition for us, because we've had some staff that's been doing this and been doing it for a while. They're not coming back this time, so there's gonna be an extensive amount of training when those people come on too. So we're gonna be really busy training people here coming up in the near future. Next thing I wanted to update you on some of the PFAS sites. So I was notified by NVHS that they're gonna be doing some more sampling at the West Side landfill over in St. Joe County. They did some sampling at 10 wells last year. Of those 10 that were tested, 6 came back with PFAS chemicals. They were all provided with filters, and they want to do some follow-up testing to make sure that we don't find more PFAS in some of the other wells, along with making sure that health recommendations from the last round don't need to be adjusted. So that testing is scheduled, I just heard yesterday, for May. So as those results come in, I'll let you know. Also, the expanded investigation at the Lear Sigler plant, I have not seen any results from that yet. So we're going to do testing not only for PFAS, but for metals and VOCs as well. And have not seen any of those results, but again, I will pass those along as I get those.
Thank you.
One last thing that I wanted to update you on, I had reported, I think a couple of meetings ago, about a homeless encampment that we had over in St. Joseph County. We have successfully taken care of that. So people are no longer living there, and that happened pretty quickly. I had law enforcement come in and they pretty much dispersed them, but then they left all the massive track, and we sent correcting orders to the landowners, and they have completely cleaned that up. So I'm really happy to report that. That was really bad, but really that's all. I think that's all I have for today.
Very good. Any questions for Paul?
Looking here, Paul, at your environmental health service statistic report.
Mhm.
The third set of columns over says year-to-date 22-23. Is that actual year-to-date or year-end final for 22-23? Because, I mean, if that's the case, then year-to-date 23-24 we're substantially lower than we were a year ago.
Okay, so year to date, I guess I'm not quite following you.
Okay, so you've got, for the month of February, we had this many permits or inspections, or
Well, I see what you're saying now.
then the next column is year-to-date for the current fiscal year. And that last set of columns labeled year-to-date for the prior.
I think
fiscal
there's an
year.
error there, Brad. I'll take a look at that, and then I'll send that back out, because yeah, that's a big discrepancy there. I didn't catch that. That's gotta be an error.
As I said, it looks like it's year-end numbers, not year-to-date numbers.
Yeah,
And on this report, I guess I would prefer a year-to-date comparison.
and that's typically what I do, and I'm not sure what happened there, but I will review that, and then I'll send it out to all the commissioners, the updated stats on it for your.
Because if that's the case, we look severely behind.
We're running, we better get on our horse and get going here,
Well, or, you know,
especially with food, yeah.
well, I mean, I don't look at that, you know, I look at the economic activity.
Right.
And, you know, you look at new on-site sewage disposal permits, and we're not even half of what that number is for new construction or new, as to where it shows we were a year ago, so.
Yeah, and I can guarantee you, there's not that big of a discrepancy. I just got the wrong numbers in there somehow, so I'll have to take a look at that spreadsheet and get that back to you.
No worries. Thank you for doing that. Thank you for catching that too. Any other questions for Paul? I had one real quick. So the homeless encampment, I know that was kind of an issue for quite a while in my area in Three Rivers. What do you think? What do you attribute, Paul, to kind of to the end result of that? Because it felt like it was kind of nobody could really do anything, and it was just kind of there, and then all of a sudden it was gone. Like, was there a magic bullet that was like, hey, this is what we did?
You know, I think it was the involvement of law enforcement and also the township. So the township had a very aggressive building zoning department.
Okay.
And they got involved and pushed the right buttons, and it seemed to move things along really quickly.
Okay.
And, you know, I was surprised by that too. Once we became aware of it and we got involved, then we kind of reached out to people and got other people involved. And, I was very pleased that it happened that quickly and we got this thing resolved in a quick manner, so.
Yeah. I just think, just looking at kind of the state of, and this isn't a political comment, it just feels like where I've been in Three Rivers, I've never seen so many people that are, I guess, in need, you know, that are in that
Yeah.
area. And it feels like it's only going to compound.
And,
So I'm wondering,
I think I made this comment last time that, you know, this encampment is gone, but I suspect that it's gonna crop up somewhere else.
I agree.
It's a real problem. It's very sad that these people just don't have anywhere to go.
Yeah.
And, it's unfortunate that, they have to do what they're doing.
Yeah.
My heart goes out to them. But, you know, we can't have that situation where they just got trash everywhere and nowhere to dispose of sewage.
Yeah.
Those
Absolutely.
things, so.
Are you seeing any uptick in complaints on local residents of maintaining garbage on their facilities?
No,
No adverse complaints?
I haven't seen an uptick in anything like that, no, I haven't seen it.
Because as I drive around the county, I'm seeing more and more garbage piles on residents' homes and properties.
I mean, we get sporadic complaints, but I don't think that, I haven't seen an uptick in that, no.
Well, that starts at the township, though,
But
right?
on that, Paul,
Yeah.
you probably wouldn't have the first enforcement authority on
No.
that either.
Well, it depends, if it's actual garbage, garbage is addressed on the sanitary code. So if they're throwing like, household garbage, trash, that type of stuff, if it's junk, there's a big differentiation between garbage and junk.
Yeah.
If you drive around, you see a lot of places that just have a lot of junk. We don't have
Yeah.
any authority to take care of that. That would really be best suited to be handled by the townships under the blight.
Yeah.
Things like that. Unfortunately, a lot of townships don't have that, and so there's no enforcement at all.
Yeah, very good.
Thank you, Mr. Chairman. I have two questions to, actually, one is a comment to Director Andriachi. Thank you for addressing that issue at St. Joseph County, that township. So I wonder, Mr. Chairman, the idea you have carried out along with the enforcement officials, can you send a memo to our major cities how you have taken care of that homeless issue? Number two, are they moved to Hillsdale County? Where did they go?
Where do they go?
Yes.
Homeless shelter in Centerville.
Yeah, there is one in Centerville, but unfortunately, you know, the homeless people in Three Rivers don't have transportation to get to Centerville. You know,
Or they set up another encampment somewhere that's
Mr. Chairman,
Yes, sir.
I may add one more. You have mentioned about transportation. I think it is in the works in the St. Joseph County under the leadership of our chairman and Commissioner Baker and our former chair,
Baylock.
Bella. I'm sorry,
Baylock.
Bella. Yes.
Yes,
So
We
they
got
got
under
the
oath.
transportation.
we do. Yep, we'll transport them. Very good. Any other questions for Mr. Paul? Okay, thank you for that, Paul. Moving on to Area Agency on Aging. Ms. Laura,
Oh, good morning.
welcome. Good morning.
I had to change the formatting on this report because there's so much to share this month. We had an amazing Branch County interdisciplinary team meeting and had a very detailed and excellent examples given by the vice president from Century Bank and Trust, whose name is Ann, I believe.
And strong.
And she did a fantastic presentation on some of the new rules that financial institutions need to comply with in terms of reporting suspected financial exploitation. She had a great audience. The whole room was full. People were not able to sit at the table, so I'm really glad she had such a broad audience to talk to. We did have walkthroughs with the division staff. They came to both the Coldwater office and the Three Rivers office to take a look at all of our facilities, our entrances, to look at accessibility, to look at comfortability. They looked at the tags on the fire extinguishers to make sure that they had been inspected. So it's a very thorough in-person evaluation of both of our county sites for staff and serving victims, and they were pleased. We haven't received any concerns back from that visit. So the next thing sort of on the docket is April 18th. We spend all day with them. And our staff, including Teresa and her team, have been preparing documents. We have a secured way to share certain things that they've asked for. We'll schedule times to meet with them one-on-one in all of our different disciplines. So we continue to prepare for that contract review. The authority in St. Joe County, the Transportation Authority, that's coming up a little bit later in the agenda. So I'll thank you in advance for that. The annual implementation planning process for 25 has begun, even though we don't have a full statement of work for this year. We still need to look forward into next year. So we've scheduled our public hearing for Wednesday, May 8th. We hope that one or all of you can attend that public hearing. It will be held here in the Coldwater office. More to come on that. I will certainly work with our team here to come up with an announcement for that to make it more formal. There will be some minor changes. The Bureau is going through operations standard changes. That process will have implications here at the local level. So providers might have to do things a little differently with their grant programs. Nothing insurmountable, nothing uncomfortable, won't affect service levels. It's just a matter of the way that they reported, the way that we fund it here. So that will be all outlined, and I'll try to highlight those changes when the plan's further along. Also, May 8th, it's going to be a full day that day. Our field representative, who couldn't join us today, Ashley, sends her best regards, but she will be down on May 8th as well to do a couple of different types of assessments. She'll assess our operations, and she'll also watch us assess the Branch Area Transit Authority. So it's a full day of monitoring and public events. So you're welcome to attend any or all of this as well. I'm hoping to get a ride on the bus. Bus to see what that experience is from dispatch to return back to the authority office. So we'll see if I can make that happen. Don't forget, May 1st is Older Michiganians Day in Lansing. They are not limiting the number of attendees on the lawn. So we would love to have a larger group with us this year. So please, if you're available, they are holding it early in May. This year they bumped it up a little bit because they want to have a stronger impact with legislative decisions related to the budget. So we'd love to have a board member or two, if it's possible, with us. And we'd like to sort of coordinate transportation for that too, so we can ride share. So certainly let me know if you're interested. And then last but not least, I'd like to introduce Becky Schuler. She's our new nurse care consultant that works in our division, and I always invite new staff to attend a board meeting. Becky's been picking up home and community-based care very quickly. She came from the hospital environment and is now working in these home and community-based programs, and she's really picked up our sort of standards and sort of the policies and procedures in our agency very quickly, and has a great calming demeanor with clients. So we're glad to have you, Becky, and I think that's all I have at this time.
Awesome.
Are there any questions?
Thank you for doing that. Any questions for Laura? Yes, sir.
Thank you. I have one question. That May 8th, the assessment day, what time it starts?
Ashley will be here at 9. There is a committee meeting, I believe, that day, or some other meeting that I'm involved in. So our care management team will be talking with her and looking at case management clients, but it will likely go until 3 or 3:30 that day. Our appointment with the Transit Authority, I believe, is at 1 or 1:30. So
That really,
we've got it jam packed.
Laura, on your Victims of Elder Abuse program, who put that program together?
Our team did,
Your team did?
yes.
Okay. I was wondering if something like that would be available to, the senior center.
Metro, we have that through the area agency and
In
anything, wildlife
Hillsdale.
services that covers Hillsdale County.
Okay, I just wondered if they were involved in this particular program.
Not through
Not
the
through
area
him.
agency
Right,
here, but through Wellwise out of Brooklyn they are.
well-wise.
Yeah, that's
Okay.
the area agency on aging
Okay,
that covers Hillsdale County.
okay,
It
thank you.
was a competitive grant that was awarded. It was sort of put out statewide. There are 2 area agencies that were awarded contracts. And then an entity, I believe the Sheriff's Department in Genesee County got a grant under the Services to Victims of Elder Abuse. Each one of our proposals and contracts is a little different with the division. So the Hillsdale project is more focused on emergency housing. They have a program that they had started earlier that was really related to housing and homelessness as a result of an abuse, neglect, or exploitation situation. So it's a little different, but similar. They have multidisciplinary task force type activities as part of the project too.
All right, thank you.
But there are resources for seniors through legal services in Hillsdale County. They also have a victim grant.
A grant.
Yeah, it's grant. It's, well, everything's grant, right? But
Right.
it's another grant funded program, but it's through legal services. So they probably help with the other side of things.
Well, and even a lot of that legal services funding comes through Wellwise to legal services.
Very good. Well, thank you, Laura, for your report, and welcome to the team, Becky. We look forward to seeing you around. Very good. Moving on to C, Health, Education, and Promotion.
Good
Ms.
morning.
Grace, Morning.
You have the report in your packet. Team is currently working on preparing for the Lock It Up campaign for this year. Funding was received for all 3 counties. It was not quite as much as we had seen the previous year. Basically because it's based upon the number of medical marijuana cards, and with the current climate and regulations, those card numbers are diminishing. So the team has been looking at ways to continue to utilize those funds with the most impact. We will be doing the bus contracts again, so you'll see the buses in Branch and St. Joseph County, 1 bus in St. Joe, 2 buses in Branch County with our Keep Kids Safe logo on them. And we have also purchased our medication storage bags. Our team has worked to create a distribution network in the 3 counties. So we've been working with Department of Human Services, law enforcement, dispensaries, and we will be providing them with a supply of medication lock bags that they can distribute that will have educational material included with it as well. Of course, we manage social media. Hopefully you got to see the MCDC dental interview that's on our YouTube channel. It was very well received. It actually got radio coverage from WLKM radio in 3 Rivers. So we were excited to see that. The community health worker program, Rachel has been very busy. It's February, she added 16 clients. When I spoke to her last week, she's up to 21 clients, which has her very busy. So the most required areas of assistance are food, health insurance, housing, and immunizations. We also were able to complete her enrollment in the Medicaid CHAMPS program as a certified community health worker. That will allow us to request reimbursement from Medicaid for the time that she spends with individuals who have Medicaid insurance. So we are continuing that process. A couple more little hurdles to overcome, but we should be ready soon. And as you can see, we've been very busy with events as they're listed, and Our car seat program, I thought I'd give you a little update on that because we usually don't talk about that a whole lot. But in the last quarter, we provided 31 new seats to families and completed 7 car seat checks. Mary reports that the weather and the end of the year holidays kind of cramped for style, but hopefully we'll be right back up to full capacity with the car seat program as well. Just real brief comment, emergency preparedness. Nathan's doing great. He's doing his 3rd exercise today, state level exercise. The program will be ending year 5 of this current work plan session. So the CDC has issued a new funding request that the state will be applying for. So we may see some changes in the work plan for the next 5 years, but we won't see that until it's a bit closer.
Awesome. Thank you for that report. Any questions for Chris?
Chris, I think I saw here that you issued 1 press release and 4 media statements in the month. I'm gonna guess the vast majority of that was related to Quincy schools.
Yes, Quincy School, and then we also had released some information about measles late in the month as well.
Any other questions? Go ahead. I'm sorry, Chris.
It was a busy meeting.
Well, thank you so much for doing that for us. We appreciate it. Moving on to D, personal health and disease, Ms. Heidi. Good morning.
Michigan did have their first pediatric death for this 23-24 season. As of Monday, there have been 116 influenza-associated pediatric deaths nationally. Best prevention and control continues to be the annual flu vaccine. This season's flu vaccines have been 42% effective so far, which is better than recent years. Currently, 25.3% of Michigan residents are vaccinated, which is down from 29% this time last year. And we already spoke about the measles confirmed cases in Oakland, Wayne, and Washtenaw. We were proactive here. We increased our advertising right away, and we have plenty of vaccine available. Possibly looking at some clinics to get them scheduled and try to get people in if they're interested. RSV continues to decrease in the country, and COVID-19 cases have kind of plateaued. We still have plenty of flu, RSV, and COVID vaccines available. And as of March 1st, all people 65 and older can now receive 1 additional dose of the COVID-19 vaccine. So I'm expecting to have a few calls on that. Amanda's our mobile unit RN, and she's been working hard with outreach calls. Her calendar is filling up quickly. She's visiting the jails at each location monthly. She's attending King's Covered in Hillsdale, Friendship Fridays at Sturgis, gyms, churches, and working with Health Ed to get a list of some areas in the community that could really use her services. We talked about her with the immigrant population. She serviced 10 families this past week. Staffing update, Samantha Keeney actually starts Monday. Just found out for sure. Supervisor. She's going to start off training in Hillsdale with Shelby because I'd be gone, but we're excited to have her. We do still have the part-timers available. For WIC, today is technically the last day of the WIC management evaluation, and the exit interview happens today as well. Shelby's been working hard along with Amy, and according to Shelby, the auditors complimented us on having higher breastfeeding rates than the state average. So that's good to hear. For Children's Special Health Care Services, they had their first in-person regional meeting since COVID, and outcomes from that included more resources and support availability for the clients, including medical suppliers, pharmaceutical needs, and points of contact at the state level. Hearing and vision techs have been busy getting ready for kindergarten roundup, and they also visited 12 Amish schools this past week and have 2 more to visit next week.
Awesome. Well, thank you for that report. So, Eddie, any questions for Eddie? We appreciate it very much. We appreciate all of your reports. Thank you for putting together those and having the time to do that. Go ahead, Brett.
Where are we at in that expansion of children's supplemental health care services for the 26-year age for those?
We are seeing them now in 26.
that increased the number, you know, percentage wise.
I don't have the percentage, no, but I know according to Terry, they've been very busy. with that, so.
That's a number we could probably get.
All right, very good. Moving on to financial reports. Ms. Teresa.
So, good morning, everybody. You have the bills before you for previous months. And you will notice that we made a payment to Apex Painting. That's for the Hillstall project that we've been working on. That was the down payment or to get started. And you'll also notice a bill from Maynard Garrison for the audit. That's part of the audit bill. And everything else. Be happy to answer any questions that you have.
Any questions?
Move to approve the
Payments?
financial payment as presented for the month of February 2024.
We have a motion. Can I guess? Oh, support. We have a motion support. Any further discussion? Seeing none, all in favor with an eye?
Aye.
Opposed, the same? Very good. Pay the bills.
All right, moving on. You have the balance sheet in front of you and the expense by program. We're currently 8.46 under budget, 8.46% of the budget. And I would be happy to answer any questions that you have.
Any questions for Teresa on the financials? Seeing none, I'll accept the motion.
Move to accept the month-end financial statement and expense by program for the month ending February 29th, 2024.
We have a motion to support.
I second, Mr. Chair.
Thank you for that. We have a motion support. Any further discussion? Seeing none, all in favor with an eye?
Aye.
Opposed, the same? Very good. Moving on to 7, committee reports. Finance Committee did not meet. Took a vacation. Program Policy and Appeals.
The program policy and field committee did meet yesterday. You have before you the special sheet, the minute of the meeting yesterday. We did have a nice presentation from the St. Joseph County Transportation Authority on an item that we will be taking up in just a minute. And we also did go to closed session and we'll discuss those minutes in a second. So, but I would move to approve the March 20th, 2024 Program Policy and Appeals Committee meeting minutes as presented.
Very good.
I second, Mr. Chair.
We have a motion support. Any further discussion? Seeing none, all in favor with an eye?
Aye.
Opposed, the same? Moving on to C, approval of the PPA committee closed session meeting minutes from March 20th, 2024.
And I believe Teresa has shared a copy of those minutes with everybody for their review.
Yep.
And I would move to approve those minutes as presented.
Thank you, sir.
I second.
We have a motion and support. Further discussion? Seeing none, all in favor with an eye? Opposed, the same? Very good. Moving on to new business. Trucking along here. St. Joseph County Transportation Authority contract amendment request. Is this Miss Laura? Are you doing this, Miss Becky?
Well, I will defer to Laura because yesterday I was absent.
Yeah, you're on vacation too, huh?
No, she's
Yeah.
working.
Oh,
I was working, just absent, yes.
okay.
We had a great discussion yesterday with the Program Policy and Appeals Committee, and Al Baylog and his is the executive director there at the Transit Authority, has joined us via Zoom. So thank you, Al. And his finance director, Bridget, has also joined and contributed to the meeting yesterday as well. We did include the PowerPoint to the full board as well, just so that you could review some of the data and some of the proposed changes. When a contracted provider is issued a contract via authorization of this board, we have to follow the contract stipulations related to amendment. And because this is what we would call and consider a substantive amendment, because it's changing the scope and or unit rate. So there's a couple factors that are being proposed to be changed. We have to bring it up through the program policy and appeals process, the committee process, as well as the full board. This will change the scope of their program and how the funds are allocated. They're not asking for an increase to the amount of funding. They're just asking for a change in how we pay and what service is supported as a result of our federal and state dollars. They offer 3 different types of transportation. We fund sort of support, if you will. It's not full support for the 2 programs, but the demand response transportation, those rides where a caller is 60 or greater and they want to leave from their home and go to a place, whether that's church or a dining center, the congregate meal site, to a friend's house, something like that, and then returned to their home. That is the major sort of portion of where these federal and state grant dollars go. They also provide a medical escort service, which is a specialized ride using a smaller accessible vehicle and is typically just the rider, the driver, and maybe a caregiver goes along with, because it's generally an out-of-county transportation session, if you will, sort of ride. And they're obviously a much more expensive ride type. So based on the very detailed report, sort of presentation they put together, I guess I would love to turn it over to Al and Bridget to say a few things if they'd like to. We wanted the full board to be aware that, of this substantive change. It was discussed in program policy and appeals, and if Commissioner Leininger is okay with that, I'd love to have Al say a few things if you'd like.
Yes, please do. He can probably picture it much better than I can.
Well, I'm not sure about that. Anyways, I'm Alan Baylog, the director at St. Joseph County Transportation Authority, and as Laura mentioned, Bridget is here as well. She's our finance director. She's been very instrumental in together that the request that we are asking for. Laura did mention, I think it's very important that we're not explain how we're doing it now and how we are proposing. We'd like to receive that AAA grant funding.
Absolutely. Thank you for having us today. Just want to give a brief to how we are utilizing the grant funds that you do give us. So we have specific routes that service any rider needs to ride with us on an in-county basis, and then we also offer out-of-county services that typically go to what we call our medical appointments. So between those 2 areas, the grant funds, both of those, and our request is to actually just reallocate the funding to solely focus on the out-of-county services that we're providing. This has come from quite a few changes in the amount of ridership that we are seeing for out-of-county appointments. And when I mention out-of-county, a lot of the riders that we are servicing, this is alleviating maybe some of their caregivers or other methods that they may not get to appointments. We are traveling to areas like Grand Rapids, Kalamazoo, Battle Creek, sometimes Phoenix. And it's for vital appointments that they need for medical services. So this is a widely used. It takes a lot of our administrative time to track the in-county rides just because of the amount that are taken. We have a couple of what we call demand response circle lines that also provide that. We don't even have the data of the riders on those. And so if we can focus more on these county rides, it'll help take some of the administrative burden off of us while still providing the same services that we already are to the riders in the county. I want to note that passengers are 3.2% of the total passengers that we served, and this is from last year's fiscal year data. However, our medical escort routes make up about 11% of the total transit vehicle miles and hours, which is substantial for the program. And obviously, spring and summer months, we see an increase in those riders as well. So we have about 6 medical escort drivers that serve the community throughout the year. Their hours for last year were over 3,900. They were close to about 4,000 hours of just medical escort, and this is for out of county services as well. And then so our dispatchers support that program since they are monitoring those routes, and there are dispatchers on staff as well. So I did a breakout down that's in but I wanted to note, we have figured that our direct lead costs are just about $130,000 for this, and you'll see that currently are asking for this program is only at $4,000. So kind of moving the full allotment that we get from this grant would just help alleviate some of that, like I said, administrative burden while still supporting what we are doing here. I feel like one extra thing I wanted to say. Oh, in the back pages, you can kind of see a breakdown of site medical access that we do provide. Operations director gave a great statistic breakdown that kind of shows where most of our rides are going to, so you can see where we are servicing. But overall, that is kind of where we are hoping to reallocate funding, but not change any of the services that we are providing to the great citizens in the county.
So Bridget, we appreciate that rundown, and I'm also on the Transportation Authority, full fair disclosure. But you guys did a great job putting together this PowerPoint and really explaining in depth on what's actually happening. So I appreciate it. I know it took some time and effort, and we appreciate that. So.
And I believe as it's been said already, and correct me if I'm wrong, but the change is going to be for the next fiscal year contract.
Correct. We don't have a full budget picture yet, so I'm not able to ask them to even prepare a budget. But what they did include is an estimate on how that unit rate and the grant reimbursement, will go up from around $2 a ride right now up to around $11, maybe $12.
But you're anticipating that grant allotment will still be in that $26,500 total figure.
That's correct.
I guess to me, the no-brainer was just the cost saving to the Transportation Authority of not having to track all of those other rides that, the non-medical rides, to get that reimbursement and just the saving for the Transportation Authority. And so I move that we approve the modified contract with the St. Joseph County Transportation Authority for the AAA grant awards for the 25 fiscal year.
Good. We have a motion. Any support?
I will support that.
Commissioner Lania supports it. Any further discussion?
I appreciate Commissioner Baylog and Bridget. They were here at our program policy and fields committee meeting yesterday. Thank them for joining us, remotely today. I didn't see the need for them to drive here 2 days in a row for 2 different meetings. So
I echo that. We appreciate it very much.
Thank you, Mr. Chairman. We appreciate your service in that board in St. Joseph County. Secondly, I know we discussed yesterday at the meetings, the St. Joseph County, this transportation organization providing jobs to 35, 40 plus individuals, either part-time, full-time. So many ways it is helping our citizens.
Sure. Yep. Very good. Okay, we have a motion on the floor to approve the modified contract going forward with AAA and St. Joseph County Transportation Authority. All in favor with an aye? Aye. All opposed the same? Motion carries. Thanks, guys. We appreciate your time.
Mr. Chairman, may I speak for a few comments here?
Yeah.
Okay. Commissioners, thank you for entertaining our request. Also, they're very instrumental in this where we're at this moment, as well as Bridget and our operations manager. This presentation together, and we greatly appreciate it. And if you ever have any questions, please reach out to us. I do want to address a comment from earlier in the meeting as far as homeless people and rides and so forth. We do assist in certain requests. People that need to be moved to, like a domestic assault shelter, they don't have any money. We do those when we, a little bit homeless because where do you pick them up? Home next, wherever. Ideally, we have to have an address. Anytime authorities, within the county have needed our assistance in moving people, we do honor all those requests. Thank you very much.
Thanks, guys. We appreciate it. All right, moving on. New business item B, intergovernmental agreement.
Yeah, we just thought it'd be a great opportunity to give everybody an update on where your counties are at. So I believe Branch County and St. Joseph County have both approved the modifications, and I think it's on your agenda.
It is on our agenda. I guess the question I have for you is that last page calls for the signature of the county board chairperson and the county clerk. Do we want one combined signature page for that will then be distributed? So will you be sending that to the county for their individual signatures to them and forwarding that on?
Yeah, we'll do that. So, the easiest maybe to grab the one local, and then we'll move out to St. Joe and then move it back over to Austin. So, we can get started with that actually, if you're pretty certain it's going to happen.
Yeah.
Okay, we will do that.
Very good. Well, thank you for doing that.
I know Commissioner Webb is gone. Not at our meeting next week, but I'll be taking a vacation.
Oh,
So we don't need any action, obviously, on that.
No.
Okay.
just an update.
Moving on, audit report.
It's here.
Yay.
Yeah, so the audit report is back. We got it this week and I have included it in here for you to review. This has to be filed by, to the state by the end of this month, so we will be filing it. If you, don't have any major questions. Dane Porter from Maynard Harrison will be here next month to do a presentation on this audit and answer any questions that you have.
Awesome. Well, we look forward to that. Okay. Very good. No action item. No action, obviously, on that one. All right. Number 9, public comments. Any public comment? Becky, did Laura tell you about the song that you have to sing? Laura, you didn't tell her about that?
Oops, I forgot.
Or the poem she has to write.
Yeah. Well, we look forward to you joining the team, Becky. That's good. Okay. No public comment. Don doesn't have anything. He's just taking pictures. Okay.
Move to adjourn.
Move to adjourn. We have a motion. Do we have support? Support. All in favor of the aye?
Aye.
Aye. Perfect.